Doctor, can you explain what today's procedure is going to be?
Well, right now I'm going in with a 10 blade, but it seems to be dull and it might not be sterile. It looks like it's got maybe some lasagna on it.
What happened to the patient?
Well, it looks like the patient went through some sort of freak milling accident of some sort. We have about 8 clean severs, decapitations, as we like to call it in the medical field. And we are just going to go through, wow, okay.
Is that tissue salvageable?
We're looking at probably good 7 salvageable pieces, but we might...
Okay.
We're going to have to improvise a little bit here. This is probably going to be a pretty long... I'm thinking this is a breast, although I am not 100% positive. I think this is the other breast.
Doctor, do you think that the fact that this patient's been in hypothermia for the last 24 hours is going to help or hinder your surgical?
It is definitely going to help. We're going to have to put them on, it's called blood rewarming. We're going to have to put them on circulation as soon as we jumpstart their heart.
Looks like nice legs.
The legs are really, they're intact. Just look at this clean sever right here. I'm worried about the breast. As you can see, there's some dead tissue.
A little necrosis set in, huh?
Yes, a lot of necrosis, a little decay here. We're gonna see how much of this we can salvage. Oh, okay, so this is not good. If you can see right here, this is some major necrosis along here. So, you know, they might not have full function of their lungs and their organs, but we're going to get them all sewed up, and we're going to see what we can do.
All right. So, doctor, it looks like maybe you've run across a little problem already.
Well,
what did you find out here on the patient?
It looks like UNOS actually sent us the wrong organ here. We have 2 left breasts.
Oh no!
As you can see, so
when you put them together, they're
it's sort of like backwards.
Oh.
And that's not quite right. So we're going to have to do it's a new tactic. It's called the rib out. And so actually the ribs and the organs are going to be on the outside of the chicken, and it's going to look a little bit like that.
Where do you suture together? And
Well, you know, we're just going to go along and we're going to see what we're working with. You know, that's my philosophy. We just see what we're working with and we just sew it up together. Scrub Nurse Berkeley, excuse me.
Okay, so it's looking like it's working pretty good on
So we have we're going to just start a new line, but if you can see here, I've got a clamp on and just suturing up the leg and the thigh together. You know, Dr. Duckler and I have different approaches. He's sort of going for a, you know, skin graft more, I would say, than a more of a, I'm looking for more mobility. He's looking for more
cosmetics,
I would say. You know, so the patient will get a little bit of best of both worlds. You know, he'll get the mobility on the left leg and he'll get the beauty on the right leg.
Okay, let's see how your leg and thigh worked out, Doc.
Okay, so I did some sutures underneath here.
Wait a second, let's get in there.
If you can see underneath the skin, maybe I did some sutures
I need to look at Jimmy, can you get the focus on the camera fixed?
It's alright. It's alright. I did some sutures on the midline here underneath the flesh, and then I took a little bit of a cosmetic approach, and I wanted to make sure this patient had the full skin. So I sutured up the skin back onto the flesh and attached some ligaments.
Let's get a close up here of that.
Okay,
your work is excellent work.
There's the skin line sutures, and it's pretty tight. You know, it's pretty much back to normal. If anything, better.
Wow.
And then on the back, we've just got some sutures here and there, holding up the bones.
What number you use? Like a number 3
dental
grade.
I did 4.0 proline. 4.0 proline.
Okay, and it looks like Dr. D here. So
you're a little bit ahead of me, it looks like, but it's looking great.
It's got the leg and the thighs attaching to the breastplate.
Right.
Well, you certainly have definitely taken the cosmetic quality of life approach.
I think that you might have taken the, you know, I think that yours is going to definitely be a little bit more strongly attached.
Well, my background in emergency medicine, I really don't pay attention to the cosmetics.
Right. Well, being a woman, I do pay attention.
Okay.
We are in the final stages. As you can see, we've got the wings on, we've got the thighs on, we are making the breasts work. We were just talking about how we aren't super sure about the cranium and the heart vesicle, but, you know, as we were saying, it's never a doctor's job to be. Okay, here we are going in the back here, sort of dorsal sutures. As you can see, we've got the clamps down, everything is looking good. We're just taking the final sutures here, and everything is looking great. As you can see, there's the stitches. Really nice job by the attending there, and we got full mobility, as you can see. Look at that, wow. See, now that's impressive. We were not expecting that at all. That's a great outcome. We got the legs are, you know, they're good, they're great. They're gonna, with some physical therapy, it's gonna be back to 80% mobility, I would say.
Okay, so if you recall, this guy came to us in the emergency room. Somebody had found him abandoned at a supermarket in like 8 different pieces wrapped. We then proceeded to carefully reattach his wings, his legs to his thighs, and the thighs to the chest. And as you can see, he's sitting up right now waiting to get into ECMO, but let me turn him over so you can see him from all angles. Back.
Yeah, so that looks really
Everything's
good.
good.
Yeah, we ran into a little snafu when we got 2 left breasts, but we did the best we could. I think
he's looking good, and for a guy that was about to lose his life in the, you know, I think you really can't complain.
Right. So I think our next step, we're going to put him in ECMO, which is right over there, the ECMO machine. Commonly, it's also known as the oven. We're just going to rewarm him. And then we're going to see how he does after we take him off the anesthesia.
I'm going to ask you to, Dr. Eva, to point out a few of the things that you can tell me about
this
patient and some of the techniques that you guys worked on together.
Well, you know, we did some pretty major suturing. There's a lot of suturing. I'm pretty proud. We did a nice reworking of the skin. Like you can see right here, this is pretty good. This is pretty cosmetically sound.
Very nice.
You know, we just worked really hard on it. We were really good teammates together. I just always look forward to working with Dr. Duckler, the suture attending at the hospital. You know, I'm just really proud. I just feel good, like I do every day. Save lives every day. It's a good day to save lives, right? I'm back. I'm actually in street clothes. I'm about to go to a medical formal here. So just want to check up on my patient. That's what good doctors do. They make their rounds. We're about to take him out of ECMO. So let's just see how he's doing. Oh, beautiful. Great. Wow. He is all warmed up. That is about as alive as it's gonna get. Alright. Ooh. Yep. Okay. Come on. This is a little bit tricky. And you know, there's one interesting side effect when we're dealing with poultry patients, and that's that as they start to warm up and they start to regain their life, they actually gain a really fragrant, nice smell, and it sort of smells like you're at home cooking dinner. You know, it's really weird. That's kind of a paradox in many ways. So as you can see, this is it. He's ready. He's done. We're gonna take him off the anesthesia, and just really good work here all around.
Yeah, that looks great, Doc. Okay.
Yeah, so as you can see, it's nice and crispy. We got some crispy sutures. You know, that is a sign of a good suture. Look at that. I am pulling. Oh. It's healing, I think. It's healing. I think maybe I shouldn't pull on this.
How's the back and his sides look? But his arms look fantastic, and the legs. Let's
just take a look here. Oh, beautiful.
Can you bring it over here? So.
Oh, yeah. Okay. So we might. Can you see that?
Just barely.
No, let's just get a double.
Can you turn it towards?
Yeah, we can. Oh yeah, here.
Oh yeah.
Oh, we might
need a second skin graft, or
see, now there's where the necrosis is. That's a little bit. Maybe we might want to. Well, anyways, thanks for visiting Lake Ridge Hospital, and thank you. And we love what we do.